on this episode of Clear the Air.
You know, if someone has kids and they can't afford to take them to the dentist, take them to the dentist because the dentist will treat them, especially if it's a kid. I just don't imagine that if a kid has a rotten tooth, the dentist is not going to help that kid.
Early diagnosis, we can do more prevention. We can do more for you. And so interesting that fact, they said wait till you're almost dead.
Yeah, that was, to me, one of the drivers that made me lose a lot of trust and confidence in what our public health agencies were doing in 2020, 2021. The best place for people to learn all this is in school. You know, teach kids when they're young good things, and they'll grow up and do those good things. Welcome to the Clear the Air podcast. I'm your host, Nate Jones, and I'm here again today with Joel.
Hello, everybody.
That's all we get from you today?
Hey, it's great to be here today.
Okay. Well, it's coming up on August, and, the kids are all going back to school. I have 2 young children. They actually, at some point, want to do a podcast with us, so I may have them give a podcast about being back in school. But they're going into the 6th and the 8th grade. And, we just thought we would do something, a podcast on public health and school health and how some of these initiatives are there and whether or not those initiatives are good and what they're doing to help improve the health and the abilities and the access to health care for a lot of these young children when health actually really matters. And there's a lot of children in America and in the world that don't have access to good health care. And so why is it important that public health actually steps up to the plate and helps with these kids that are in schools that aren't getting good coverage at home?
Yeah, I think it's a great mechanism because we think totally about kids going to school, and probably the initial thought, an overwhelming thought, is they're going to learn. That's all they're doing there. But you have them contained for 6-7 hours a day, and it's a great avenue to provide that, especially those who don't have access to health, to provide that health to them.
It's funny that you use the word contained. Have you ever really tried to contain a bunch of kids?
No.
But anyways, I have 2 kids, and it's like herding cats trying to contain them. But you're right. And we should say that there's many aspects to school that pertain to student health. They can't learn if they're not healthy. Or if they're not healthy, it makes it much more difficult. If they're sick, if they're coughing, if they have asthma, even if they have things as simple as tooth decay, it hurts. A couple of years back when we were trying to get the state of Utah, where I live, to actually implement xylitol gum chewing programs, we went down and met with a couple of school nurses. And I don't know if you were, I don't think you were there, but we sat and chatted with them, and it was really interesting because they sat there and told us that they had a high number of kids in their schools, and these are elementary schools, where the kids had such bad pain in their teeth that they couldn't concentrate. And the sad thing about that was that the school staff knew and understood enough. They told me this, that the kids would come in and they wouldn't share the pain with their family because the kids understood that their parents couldn't afford to pay for them to go see the dentist. And so they would hide that pain from their parents, but then they would come to school and it would disrupt their learning. And so you're really perpetuating a cycle right there. But in schools, they have all kinds of things that are going to pertain and help kids either grow up healthy or not. They have counseling, they have PE. Most kids eat school lunch. And if it's garbage in, it's garbage out. Hopefully, they're feeding them good food. I know that the school that my kids go to, sometimes my kids will eat it and sometimes they won't. A lot of times they look at the menu and come home and say, Dad, I need you to fix me a lunch tomorrow because I'm not eating school lunch. So I'm not going to say where my kids go, but I remember when I was a kid, I used to scrap together back then. I think it was 25 cents a day for a school lunch. Maybe I'm dating myself, but we got a carton of milk and something. And my mom and dad, because there was 14 kids, how am I thinking of this just now? My parents told me back then they couldn't afford $2 a day. My parents said, hey, we can't afford school lunch. And so they always sent us with a brown bag. And I remember sometimes the other students would trade, and I would give them my lunch, and I would go in and eat their lunch. Or if I was a hall monitor, we got free lunch.
Oh,
and so
yeah.
I was always, and now I'm sitting here thinking back and going, it probably cost my parents more than $2 a day to make us home lunches.
Oh, yeah, I bet.
But anyways, that was Idaho. But, there's a lot of stuff that happens at school that is going to pertain to the long-term health of our children. And, they have hearing and vision tests, but, there's more to it than that.
Yeah, I mean, I remember scoliosis test as well, right? They did the scoliosis test for us in 7th grade, I think was the first time they checked for scoliosis. But we were doing the vision and hearing test all the way up, and it certainly doesn't change. My youngest is going to be a senior this year, and he knows exactly which lines to get into if he's going to get school lunch at high school, and he knows which lines to avoid. So it is more than just that, and all of these things contribute to it with these tests here. The vision test.
Wait a minute. What do you mean he knows what line to get into for lunch?
Because some of the stuff he won't eat. It's gross, like you were saying.
Do they have different food in different lines?
Yes.
Oh.
Yeah, they'll have like a
What is it,
sandwich.
like a chef station here?
Well, I wish they were that good.
They
but
got a salad bar over here, and they got Chef
That's
Boyardee over here.
That's
and
exactly it.
Wolfgang Puck over here.
That's exactly it. They'll have a sandwich line. They'll have a salad line, hamburgers, whatever it is, pizza. They won't touch those lines because they know that it's gross, or there's ones they'll stay in, and they're the longest lines because everyone goes to them. But yeah, I was surprised to hear that.
Huh. Well, that tells you. Last time I had school lunch was, 1984. Because I don't think I had a school lunch the whole time I was in high school.
You left and went off campus for lunch?
Well, my sophomore year, I lived in Mexico City. We discussed that another time.
Oh, yeah.
So they didn't have a cafeteria. I would go across the street and get me a torta. It was just a sandwich made out of a bolillo, a piece of bread. And I didn't go to 6th, 7th, or 8th grade. So last time I would have had a school lunch was 5th grade.
Mid-'80s, huh? Yeah,
Early
lots changed.
80s.
Early 80s, yeah. A lot's changed.
So, yeah. Anyways.
So, yeah, the testing, certainly, it's good that they are doing the testing. I remember the vision and the hearing test every year, and that hearing test for me was a game. I wanted to try to see if I could hear the lowest or maybe the highest beat there as they had those headphones on, but you could never tell once it went past your hearing capacity. But, yeah, I remember doing those, and then the scoliosis in 7th grade.
See, I don't remember any of those. Again, I didn't go to 7th grade, so it doesn't matter. I don't remember any of those. The only one I remember is when they would come in, the dental hygienist would come in twice a year and give you a toothbrush and some pink pills.
Yeah.
That was really the only one that I remember. When I was in the Army, I got hearing tested and vision tested, and obviously whenever I go get a driver's license, they make me do the vision test.
Yeah, the vision test was always simple.
And being a pilot,
Yeah.
I have to go do that every 2 years still.
Thankfully, because I've flown with you once. I'm glad that you had the vision test. Yes. So the hearing test, they always pull up a trailer, and they'd have 4 or 5 doors that go in, and you put those old plastic rubber headphones on, and you'd listen to it and push a button down every time you'd hear the noise.
Oh, well, there you go.
Yeah, quite the experience.
I'm sure I've had that. I just don't remember it.
I remember. I think it was every other year. I don't
Once
think
you get to
they
my age, you kind of get a little.
Yeah, I bet. So, tell me, are these federally mandated? These tests?
I don't know that any of these tests are actually federally mandated. I mean, they might be, but I don't think they are. In fact, they're giving me some data right here telling me that no, they're not federally mandated. There's no federally required school health screening form or set of school health screening requirements. But should there be? And that's a question.
Well, I think that's an interesting difference between some of the other things in regards to health care or sick care, as you sometimes call it, that is federally mandated or at least matches across the nation, state to state. It sounds like this is probably more a state issue that's regulated.
Yeah, I mean, I think that public health, and I've said this before, I think, in other podcasts, but I think that public health it should be playing a much bigger part in a different way in promoting health in the United States and in the world. And I think that having these things where they're going out and screening, where they're going out and checking the children, I think that's an important part. But again, I think there's a lot bigger part that I think is more important, which is actually implementing programs, educational programs where they're going out and teaching you about oral hygiene, where they're going out and teaching you about diet and nutrition, where they're going out and teaching you, about nasal hygiene, hygiene in general, public sanitation, stuff like that. Because I think we used to get that, and now we just accept it, and we don't teach it anymore. And the younger generation is growing up not knowing why we do some of these things, and we just assume they do know it.
Yeah, I think with either an increase in healthcare workers or whatever the case is that drove us away from that, us as a nation, I agree. We should get back to that because it seems like now they are just allowing it to get to the stage and then sending them off to be treated for it, as opposed to the suggestion you're making is prevention. And if there is that many healthcare workers, you would think they would get them into a stage where they would be coming to the schools, teaching them, and it should fit right into the regular curriculum. They should be having this healthcare.
But I think, and this is a problem, and I have a niece who is sitting here trying to convince everyone that she wants to go to medical school to help people and to help people be healthy. And I'm trying to convince her that if she really wants to help people be healthy, don't become a doctor. They don't help people be healthy. Sorry. I'm just saying it like it is. They help sick people get better in exchange for a bunch of money. If you really want to help people improve their level of living and their health, go into public health, go into nutrition, go into exercise physiology training, stuff like that, where you're actually going out there and proactively teaching people how to be healthy, not drugging people back to health.
Yeah, I think that's a great point because it seems like more everything is academic related as opposed to life, especially in the lower grades, the middle schools and high school, when they should be helping them. I mean, they make a big focus now, or at least some people do, about teaching them how to balance a checkbook, how to do your personal finances, how to do those things. There are some schools that are...
Wait, they teach that in school now?
Not very often, but there are some schools that are pushing for that and think that should be part of the curriculum. I think this falls in that same area.
Who still uses a checkbook?
Well, balance their accounts, whatever it is. You're right. It's a debit card.
What's a checkbook? I'm kidding. I'm old. I wrote checks this morning, actually. I put them in the mailbox before I came in today.
No email, huh? Nothing? You just...
No, I mailed.
It was snail mail?
Yeah.
Well,
snail mail.
And I guess my point is, if they're doing that, those life skills, this all falls into that same for me, because they're eventually going to be faced with them, and they won't have any of that knowledge, especially those who are low income and don't have it at home, coming to the school for it. And then those who do have it at home still can get that like we used to. I remember those red pills too. We'd take those, or pink pills.
They should have a whole class that's mandatory for kids in junior high and another one in high school, just called Life Hacks.
Right.
And where they teach them all this stuff, how to balance a bank account. Money in, money out, buy low, sell high. Buy low, sell high, and things like that. And teach them how to exercise, teach them about nutrition. And, I'll go back on that one because we should do a whole podcast on that because nutrition is such a difficult thing because what's good for you isn't good for me, and what's good for you isn't good for me, and what's good for you isn't good for me. Nutrition is something that we all individually have to find that. And I use this example, and I tell this to people a fair amount, but, I went to become, I read a book called The China Study, and it was a pretty good book. And after I read it, I was like, you know what? I think I'm got to follow this. I think I'm going to be a vegetarian. So I was a vegetarian for a good year, pretty solid vegetarian.
Wow.
And I blew up to about 320 pounds. I got big. Well, not that big. But anyways.
Full-on vegetarian.
Yeah.
Following it.
Yeah.
All day, every day.
And and after a year, about a year, I actually went heli skiing. And for a buddy of mine's birthday, it's the only time I've ever been in my life. I keep thinking I want to go back, but I'm embarrassed to go back because they're going to laugh at me and say, the 320. Anyways, the helicopter could barely get up. No, it got off the ground easy. Anyways. But when I saw that, I said, okay, this isn't working for me. And so I went in and I changed, and I actually went on a keto diet. And I lost the vast majority of that weight, but it took me about 2 years. And I kept most of it off. I've put some of it back on, as you can tell. I'm not looking like Arnie Schwartzy. But obviously being a vegetarian didn't work for me. I have a neighbor that I play cribbage with a couple days a week. He's a vegetarian. He's been a vegetarian for 25 years, since before his kids were born. It works for him. He's healthy. And so the point of that is there's different diets. We as people just need to have the initiative to go out and find out what works for us, what we can do in order for us not to become 325 pounds and still try to go up the mountains and ride skis down a mountain.
Well, and I think that's the key. Like you said, oftentimes we're not considering or drawing the correlation between what we've eaten and how we feel afterwards. I mean, sometimes you feel sluggish or you get headaches or whatever you're doing if you're taking too much of whatever. But the correlation of our activity throughout the day, the correlation of gaining weight or losing weight, all can correlate to that. But the nutrition is the key, and finding the right mix, whether you need to go out and get help or you can do your own self-study and learn that. But I think we don't put enough emphasis on the effects that happen afterwards. We just assume as we're getting old or we slept wrong or whatever.
Yeah, I sleep wrong every night, I guess. So anyways, they gave us a bunch of stats here to read through about how children are. And so I want to read through some of these, and then we'll discuss them. But I'll read one, and then you read one. We have them, so we can do
Got
that.
them.
But I'll read the first one. It says, though estimates of prevalence vary depending on population and specific vision issues, studies show that 22 to 30% of children fail vision screening. About 80% of learning occurs through visual tests. So it's fairly important that kids understand what they can and can't see.
And I think that's something that they're embarrassed of. If they get in the classroom and everyone else can see, they won't admit it again until it gets to a one-on-one situation. They're not going to tell their friends they can't see from whatever seat they are. But there's things teachers do for that. If they can get that communication, they'll move them to the front or give them a different option. So the next one says about 1% of children entering school are estimated to have hearing loss. What? However, concerns are increasing about noise-induced damage, and studies have shown higher rates of hearing loss in adolescents, especially when high frequencies are added to the screening test.
Wait, higher frequency of hearing loss in adolescents. Is that why my mom told me not to wear headphones? Dang it. As a teenager, I knew everything. I've forgotten most of it now.
It's the fault of the headphones.
Don't worry, I'm dealing with my own teenager that knows everything right now. While asthma affects about 9% of school-aged children nationally, rates as high as 30% have been shown in high-risk minority groups and high-poverty neighborhoods. Poorly controlled asthmatics have been shown to miss 18 days of school per year due to asthma, compared to 2 days per year per students whose asthma is well controlled. And I'm assuming that 2 days is simply 2 days for the asthma, not 2 days for another illness, or they're just going to the lake. Not that I would ever skip school just to go to the lake. So
Interesting. Now, one of the things my kids find funny is I grew up in Los Angeles, and we would have smog days. So towards the end of the day, it was so smoggy outside that we couldn't go outside where they wanted to stay in a classroom. I'm assuming to breathe filtered air that was coming through whatever we were doing, but we had smog days. I always look back at that, and I thought initially that was the reason why I had asthma. Probably wasn't. Mine's exercise-induced, but I can tell you I didn't know anything about it. All I knew was when we were out playing, I would get fatigued very quickly, and all my buddies were doing whatever else. I still had what I thought was energy, but the asthma was limiting me until I got a rescue inhaler and started using that and realized this is how the world breathes when they run on the soccer field or playing basketball I loved, and I'd get tuckered out after just a few minutes, even in elementary school. But eventually I got that rescue inhaler.
You know, I had cousins in L.A., and they used to always come up to Idaho to get out of the smog days.
It's pretty bad.
Yeah.
Yeah, it's only gotten
Anyways,
worse.
so the next, you're going to read the next one.
In a national survey from 2015, a percentage of children with serious emotional or behavioral difficulties among children ages 4 to 7 was approximately 4%, compared with children ages 8 to 10 at 6%, and children ages 11 to 14 at 8%. Similar studies have shown that an additional 17% of children ages 6 to 11 had minor emotional or behavioral difficulties.
Now, come on, let's get real. Children ages 11 to 14 only have 8% emotional issues.
That's what it says, huh?
Emotional behavior. Yeah. I think that number is like closer to 70.
That's the ones who don't suffer from it, maybe.
Yeah, I think this is wrong. Bad news here.
It seems like
it can't be 8%. I mean, I know that I was messed up when I was 14. Well, never mind. Okay.
That preteen and teenage is pretty scary.
So here's one that comes back full circle. About 37% of children ages 6 to 9 have dental caries, but the number almost doubles to 70% for children that live in poverty. Okay, approximately 14 children overall have caries that are untreated, but the numbers exceed 30% in high-risk minority populations. And that, I think, those are underreported, I think. I work a lot with dentists, and I think it's a lot higher than that. And one of the things that I do know is, at least I believe, because I've talked to a bunch of them, if someone has kids and they can't afford to take them to the dentist, take them to the dentist, because the dentist will treat them, and he'll probably try to charge you, or she. But if you don't have the money, they'll figure something out. Especially if it's a kid, I just don't imagine that if a kid has a rotten tooth, the dentist is not going to help that kid. That would be, okay, I just don't believe there's people that bad in America. But anyways, the next one.
According to the national survey data, among households with children, about 17% of households experienced food insecurity during the prior year.
That's a pretty high number.
That is.
And that's almost 20%, 15 to 20%.
So a fifth?
Let's say a sixth-ish. But that's still a lot. And it's higher than I would think it should be. And I think that most elementary schools now have lunch programs.
Most of them do breakfast too. They have breakfast and lunch.
Yeah. See, mine never had breakfast.
Yeah. Well, mine didn't either, but especially since the pandemic, they've offered breakfast and lunch. And most of them did it before, especially at the younger ages.
Yeah, my kids, there's the school that they go to, I know that they do a breakfast, but I've gone in and looked at that breakfast, and I don't want to harp on it, but I would probably let my kids go hungry before I let them eat that garbage. Just saying.
There's a reason why it's called
Fruit Loops.
There's a reason why it's called institutional food. It's easy to do to the masses, right?
Yeah, well, it's not even food. It's just go give them some sugar and call it good. Here's one that lead exposure primarily affects children under 7 years old, but the effects are significant and thus extremely relevant to screening in the early years of school entry and attendance. Nationally, about 2.6% of children younger than 7 have elevated blood lead levels. But in high poverty populations living in high-risk areas, studies have shown histories of elevated lead levels in as many as 70% of the children. So those are just some of the stats concerning our kids, and I think that public health should be doing as much as they can to address a lot of these issues. And I think a lot of this is going to happen in the schools, and it should happen in the schools. But I think that there's a bigger aspect of public health, even in the adult population, that should also be addressed in a non-pharmaceutical manner.
So I guess the question comes, is there enough? Are we doing enough? Is it effective? Should they be mandated? Should there be some level of this in the schools for the health, whether it's low income or middle class or high income? There's always going to be some level of children not wanting to tell their parents about something, more so on the lower level income, obviously, because they're worried about how can they take care of this. So, we can't solve it, but if we talk through this, how does that work, or how do we mandate that? I think a lot of times if they make them aware of what's happening, and I think there's some good people out there. The nurses, those who are trying to educate, there's a lot of people in the professional world trying to educate them about oral health and everything. But identifying those and then leaving them to have that identifying illness or whatever it is, vision or hearing, without a solution, just creates more problems.
Knowledge, if you don't do anything with it, is a curse, I guess. And you can go out there and do all the testing you want, and this goes back to COVID. I'll give you a great example is during COVID, they were out there testing people all the time for COVID. Well, you can test them all you want, but if you test positive, what are you going to do?
Right.
I mean, we sat there and we tried to get the government here in Utah. We're like, hey, we'll give you 100,000 bottles of nasal spray that we know helps block the adhesion of COVID, that we know helps wash it away. The saline, just the saline we know, in all the studies that they did at Vanderbilt and everywhere else, just using salt water, it was 100%, effective at treating people that had COVID just by washing out their upper airway. They can test all they want, and here in Utah, they were testing like crazy. And we offered to give the public health people here in the state of Utah 100,000 bottles of our nasal spray, our product, and just hand it out to people. If they test positive, give them a bottle of clear and let them use it. And, within 100,000 people, they would know that it was working or not. And the funny part of it is that the state said, no, we only want to test. We don't want to do anything after that.
Which, that's where I think the fault or the gap lies. You think about these things, and if they're doing these effective programs, I would imagine there are several businesses, corporate America, that would like to be integrated into this. You think about all of the dental care that's being identified. There are plenty of people. Clear offered our spry gum for a whole program to help with caries. The nasal spray, it seems ludicrous that they're turning those down and only then saying, we want to identify, and then they're on their own. When we know they can't afford it or they aren't going to do anything. Those are all known factors, and they're still leaving them that.
Well, I think that is one of the failings of public health, I guess. I have a diagram that maybe I should draw up and show that really, to me, illustrates where public health and institutionalized, except it's not institutionalized, it's hospital health care after you're sick, responsive health care, reactive health care instead of proactive health care.
Yeah.
Public health should be in the proactive health care. Hygiene practices are in proactive health care. They're all, doing stuff to improve your standard of life and your health outcome. Whereas reactive, which is all the drugs and the hospitals and the doctors and everything, that's you break a bone, then you go in there and you have them fix it. Or you have cancer and you go into the hospital and they try to make you better. Or you have COVID and they go into the hospital and they try to make you better. That's reactive. And that's where all the money is. I mean, and I think it's a travesty, but even during COVID, for some reason, the biggest advice that everybody remembers is wait until you get deathly ill and you can't breathe, then come into the hospital. And that's the first time that I'm aware of where that advice has ever been given to somebody.
Right.
Or a population. Wait until you're really, really sick, and then come in and let us look at you.
Yeah, it seems like everything else would be opposite, or the advice. It was interesting that's the case, because they will always drive individuals to early diagnosis, right? It's the case with terminal illnesses. It's the case with viruses, bacteria, heart conditions, whatever it is. Early diagnosis, we can do more prevention. We can do more for you. And so interesting that fact, they said, wait till you're almost dead.
Yeah, that was, to me, one of the drivers that made me lose a lot of trust and confidence in what our public health agencies were doing in 2020, 2021.
Yeah, because there were a lot of things that maybe they had to guess at being so new, but that seems like one of the things they should have known because it followed along with every other illness, right?
You know what's crazy? Call me crazy, but it wasn't new. Yes, it was a novel coronavirus, but what people don't really grasp and understand is that prior to 2020, okay, we have this illness that goes around that we call it the cold. And about 40% of the colds, 60% are caused by rhinoviruses, but about 40% are actually caused by coronaviruses. We have been getting sick from coronaviruses for ever, I guess, millennia, decades, at least a week or two. But anyways, even prior to 2020, the CDC had on its webpage that one of the better ways to treat a respiratory coronavirus infection was through saline irrigation, through washing the upper airway and physically reducing that viral load. So, yes, it was one novel virus, but the media and public health made it out like it was this new virus and no one knew anything about it, and we were all in the dark, and we're just shooting here, and we're just trying to figure it out. But the reality of it is we already had a ton of data on how to treat respiratory coronaviruses. We already had that data. It was on the CDC's webpage. And the funny part of it is, it was on there until we pointed it out to the FTC. And then a week or two later, it was
Disappeared.
It was conveniently disappeared. We're asking for that data and why it was taken down, and in our lawsuit with the great and glorious and amazingly wonderful government.
And we're still waiting.
And we're still waiting. You know.
Yeah. Well, I think that's a good point. You're exactly right, and I thought it was interesting. Even on our spray can of disinfectant in the house, brand name left out, it said on the back prior to COVID that it would help with that, with coronavirus or COVID, it said. And so
Wait, prior to
the pandemic, it said that that's one of the germs it would help.
coronavirus or COVID? Because COVID is a disease.
It was corona.
Coronavirus.
It was corona.
Okay, coronavirus. Okay, yeah. Well, obviously Lysol. I mean, I'm sorry. Lysol, can you? What do they call it? Support us.
Sponsor.
Lysol. We'd like you to sponsor us. You do the outside, we'll do the nose.
Yeah.
Anyways, I actually have a diagram, and I'm going to draw it up right here, and hopefully, they can work their tech magic, and I'm going to narrate it as I draw it. But this is how I look at the role that public health has, and the reactive healthcare system has, and they need to work together in order to make us a more healthy population. But right here, you have a line. And this is where you're perfectly healthy, okay? This right here is where you're dead. And right here is your baseline here. And so if you are perfectly healthy and you're going from being healthy and you're getting sick and you're dying, right here is where infection happens, okay? But this kind of, and again, this is very general. It's not specific to anything. But most of your diseases, if you catch it here, it's easy and cheap to treat, okay? And as it goes up to here, it gets more and more expensive. If you're at the gates of death, it's usually going to be fairly expensive to bring you back. And that's the way healthcare works. And right here is, let's go with blue for public health. But right here is where public health really should be shining. This is where they should be talking about hygiene, okay? This is where they should be talking about sanitation, okay? This is sanitation, exercise, nutrition, but this is where all of this comes into play. But this is where public health should be working. This is where the CDC and the Surgeon General should be spending their efforts, okay? But they're not. They're too busy talking about drugs and pharmaceuticals and stuff like that. But this right here is the cost to treat. And I made it in green because green is obviously the color of money. So, it costs more. The longer you go, the more it's going to cost. And here is where your reactive health care. This is proactive, this is reactive, and this is where your hospitals are. Your doctors, your hospitals, and doctors, they actually will work over here too, because sometimes you're not sick, and you go see a doctor for a wellness visit, and the doctor says, you probably should exercise a little bit more, maybe you should, eat more veggies and less Big Macs. That is all where the doctors are going over here, which they should be doing. I agree that they should be. I don't think they do enough of it. But a lot of them are just going to go put you on the little shot that you shoot in your belly and call it good until you eat what you want. And that's, again, not good. This is one of the things that really surprised me is, we just discussed this, but this was the COVID advice in 2020 when they sat and said, hey, don't go into the hospital until you're nearly dead and you can't breathe. All that did was increase the amount of money it would cost you to get better. It probably saved your life if you did that too, because if you came in here, they would just throw you on a ventilator because the hospitals, and we found out after the fact that the reason why they put you on a COVID ventilator wasn't for your benefit. It wasn't for you. It was to prevent you from breathing coronaviruses all over them. And a lot of people died because of that, which I think is incredibly selfish. But all of this stuff back in public health, all of these things that I'm talking about, the best place for people to learn all this is in school. You know, teach kids when they're young good things, and they'll grow up and do those good things. Is that okay to say that?
That is, yes.
Teach children wisdom in their youth. And they will grow up to do that. I mean, my parents taught me good nutrition. I still don't eat cracked wheat for breakfast because they made me crack the wheat myself with this big hand grinder. But I do eat oatmeal and eggs and bacon and stuff like that. But again, what I learned when I was a kid is really a good foundation for me being as strong and healthy as I currently am. And gosh, that's not good advice now. Dang it, I hate it when that comes. Anyways, I think I did a good job. But those are all things that need to happen, and I think a great place for them to happen is in the school. I think the school screenings are great, but I think that where public health is failing is they're taking those screenings and not helping people to take advantage of learning all of that when they're young and changing their bad habits, which I think they could easily do. And the money that public health would have to spend on that is a fraction of what they will have to spend if they don't treat those kids.
Yeah, I think that's a great point. The graph is great. You thought of that all on your own? That's pretty good. I like it.
I don't know if that's a compliment or a...
It was. No, it was good. That public education, look what it did for you. At least a portion of it.
Man. My grammar teacher, my penmanship teachers are all rolling over in their graves right now.
Well, due to the magic of cameras, we can probably write over that and make sure that it's legible.
Well, then delete what you just said, too. Because then they'll never know. So, anyways, but that is, I think that is what we need to do. I think people should push for their public health agencies. They need to go into the schools and ask them why they're not doing it. The schools pushed back on us when we tried to give them free gum. I think that every school should be handing out free xylitol candy, lozenges, or gum to the kids as they're coming into school in the morning. The studies that have been done in the 90s, University of Michigan Dental School, I mean, I know it is Michigan. They have a lot of lead in the water, I hear. But the University of Michigan Dental School, they did a study, and they showed a 42% reduction in respiratory infections and a nearly 100% reduction in tooth decay just by using gum with xylitol a couple times a day. That cost the state $25 a year per child, and the state refuses to implement those programs. They would rather, public health, my experience dealing with them, they would rather set aside and utilize, thousands of dollars per child to treat them rather than $25 per year to prevent the issue.
Definitely needs a hard look and an overhaul in terms of that, because there is so much that affects this. You preach this a lot with, and we've even seen this otherwise. Oral health leads to good overall health. There's all kinds of things that support that. But I think the big key here is even in mental health, with physical health, with nutrition, with exercise, all of those things, when they're overlooked, they're going to affect the learning, and that results in what happens when they're done with the school system and now turn to society to be responsible. It could have all been stemmed or at least helped if they had looked at these issues more closely and some type of rigorous routine as opposed to waiting to treat it when they see results or symptoms. So I agree.
Okay, well, reach out to your school boards, PTAs, and tell them to implement more public health initiatives in the schools.
On that front end, right?
On the front end.
Yeah.
I think that's important. I think that's where money is going to be best spent, in promoting a healthy citizenry.
Yeah.
Is citizenry a world? Yeah, it is. In promoting a healthy citizenry, whatever. Anyways,
that works.
But talk to your teachers, talk to the BTA, school boards, and ask them for that to happen. The individual parents are the ones that are going to make that change and drive that change. So
very good.
Anything else?
No, I think that covers what we can do.
There you go. There's another episode of Clear the Air, and hopefully you learned something, and hopefully it was interesting.
Take care.
Thank you, and we'll see you next time.
This episode was hosted by Nathan Jones, co-hosted by Joel Melton, produced by David Monk. Associate producer, Matthew Davis. Video and audio were edited by Caleb Scoresby. Research by Sabre Bills. Graphics by Joseph Thornton. Music by Augusto Diniz. If you enjoyed this episode of Clear the Air, be sure to follow, like, and subscribe so you don't miss out on the latest episode. Have a favorite episode? Share it with a friend or on social media. New episodes of Clear the Air are published weekly on YouTube, Spotify, Apple Podcasts, or wherever you listen to your podcasts. Thanks for listening. We'll catch you next time.